Yeah. 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 Right. Jack.
I have a question because I know that in our practice that age is a factor. The advice always based on age.
Yeah.
Somebody's in advanced stage, let's say, some kind of already changes to spine.
Yeah.
And those injuries, because in the 50s, 60s, there will be always good outcome versus maybe some problems.
Yeah.
Which is position?
Well, listen, I think that, here's the thing, is, pain is a very unhealthy thing to have, okay? It's unhealthy from many perspectives, It affects your immune system, cardiovascular system. It's generally bad for your overall health. So if you have a patient who comes in, who's in their 40s, 50s, 60s, who's in constant pain, it's important to treat that. And having exhausted conservative techniques, surgery may be the only option. And, you may only buy that patient a couple of years of pain relief. But we're never going to, cure these, the back. It's constantly degenerating. So, it's this process that's ongoing. So it's about, if a problem occurs, accurately diagnosing it and treating it without, unrealistic expectations, and trying to do it, in as least invasive a way as possible. So you don't want to fix one problem and make two. Yeah.
The qualification of the patient you mentioned before is very important to keep the right patient.
Yeah.
There's the whole process.
Right patient, right treatment, right surgeon, best outcome.
The element.
Yeah.
Have you done much work with powerlifters, weightlifters, football players?
Yeah, I've taken care of quite a few powerlifters, and they're particularly challenging because of the associated intake of other substances, which leads to this kind of like deterioration of bone quality. So I've had some cases with powerlifters where it's the fusion has not fused as successfully as I would have hoped. So I'm very cautious with that particular subset. Football players, I've had some of those guys coming in, and those guys I've had great success with that.
More fusions or
More fusions, yeah.
This makes more sense to me.
Yeah.
You have to go back to that harder competition of force and trauma.
Yeah.
You can't just do the very continuous disc, you gotta fuse it.
Yeah, I mean, those guys, with regards to contact sports, again, my advice that I give out to patients in that, is, unless these guys are like professional athletes and their livelihood really depends upon it, it's about making that choice. It's about, you want to go back to this sport, but you've got a bad back. So, you can go back, but you may end up, you're at an increased chance of re-injuring yourself. So that's really a kind of, I give them the information, and then I'm like, you have to make that choice. Yeah. All right, guys. Any more questions? Okay. So, Sig, yes, thank you.
You're tough act to follow. That was outstanding. Well, there you go. First, I wanted to thank you folks for coming tonight. A few of you know who I am and what I do with the association as a chiropractor. I also just wanted to acknowledge ND Online. You guys do a great job for chiropractors statewide and your support, so just wanted to mention that. You probably know now my last secret, and that is this is probably the stuff that I really enjoyed. I've been in practice now 37 years, but the last 7 years with the association. And when I was in California, I was practicing in San Francisco with a pretty extraordinary group called Comprehensive Spinal Care. There were neurosurgeons, orthopedists, orthopedic physical therapists, physiatrists. And it got to the point that I was involved where I would do the intake on these patients and set up treatment plans as to where they need to go and so on. And the one thing I learned before I get into two things that I just want to talk in the short time that I have, which is all I'll need, is we always think that conservative care is the place to start because it's what is fair to the patient, It's what's most cost-effective to the patient, and why do something so dramatic if they respond to conservative care? But I can tell you, in such a large population of patients that I had seen within a multidisciplinary environment, oftentimes going a more invasive, or especially with microdiscectomies, percutaneous nuclectomies, injections, and so on, these more invasive procedures, in some instances, was a place to start. Because after a short period of time, the problem is that they needed to respond quickly, get back to lifestyle more quickly, and the conservative care was more palliative. And so it seemed like when you got a bit more aggressive with these patients, their response was more dramatic. And I know as chiropractors that may sound a little odd, and I would never believe it if I heard someone like myself standing up here and telling me that. But when I saw so many patients going that way, it wasn't just about starting here and ending there. It was about what's the most effective, efficient way to start off with these kinds of patients. I wanted to talk about, just very quickly, two things. One is, when I was in California practicing both on my own and in an interdisciplinary environment, I couldn't imagine not having medical support, especially when I was on my own. Because from a business perspective, it helped me grow my business. I'll get into that in a moment. But for more importantly, I was looking for ways to kind of improve outcomes quickly, effectively, efficiently. And little did I know that by making the referrals on cases that I just was not very pleased with their outcome, I always wanted things to happen quick, which probably doesn't surprise you, and quick and quick and quick. You know, so I get on to the next one, the next one, the next one. And so I was referring patients rather quickly to other health professions to co-manage. And what I found out, equal to the patients that referred patients that I helped, a lot of the patients I couldn't help, not the way I wanted, with long-term benefit, referred as well. You'd always think, well, if I didn't help that patient, they wouldn't refer a patient. But they actually did, because the outcome was, they said, look, if you need a chiropractor, I recommend you try this chiropractor, because if he can't help you, he's going to find somebody who will. And I wasn't smart enough to figure that out until it actually started to happen. So it was just so important to be in a co-management environment. When I met Richard a while ago, and I sat down and talked and interacted, there were things that he was saying, and our first evening at dinner, I was pounding with a lot of questions, because I didn't want to waste a lot of time. But I was looking for certain criteria. Does this guy co-manage patients, rather than take the patient and send them out to physical therapists? And so you kind of were the feeder, but that was it. And when I saw the reaction was his availability, his eagerness to co-manage patients, to communicate back with you, that you can ask the questions that you want to ask, to me that was very, very impressive, because that's all that I knew when I was working with the medical doctors in my area in California. I was also pretty surprised in coming to New Jersey, because I'd never practiced in New Jersey. I practiced 20 years in California and about 7 years in Florida. And when I was in California, the medical environment, chiropractic environment, it was very conducive to a collaborative effort. This was very foreign to me to come out here, and I'll get emails 2 or 3 times a month from chiropractors saying, Sig, you know any medical doctor that I can refer to? Bottom line was, I was quite surprised how the chiropractic community was not communicating more, working more with both physical therapists and medical doctors. For whatever reason, it was that way. It's that way now, and I was just surprised. So anytime I can interact with somebody that's going to work in a way that's mutually respectful, and obviously for the patient to improve outcomes, I love this stuff. I mean, this was like a throwback to years ago. Obviously, the techniques are a bit more advanced, but I love this kind of stuff. And it was so much more fun for me to practice with really complicated cases. And my only goal then, as was now, as I talked to you, is to improve quality of life for the patient. They want to do this, they can't do that. What can we do so they can just take care of themselves and be more independent? And the techniques are pretty extraordinary, but the outcomes are the same, hopefully to work toward that goal. So I just think what impressed me more than anything was not him, it was the questions. I'm impressed with all the questions you guys are asking. I didn't know if there would be any questions after, but that's, you know, it's funny, when I did a lot of presenting at conferences and conventions, when you do the evaluation form, I always thought they were evaluating me. And somebody much smarter than I said, no, they're not evaluating you. These are helping you to evaluate your audience by the questions and the comments they have. And that's what I see here. I only wish, and I hope, that more and more doctors get involved, chiropractors get involved. There's more medical doctors willing to work with the chiropractors and so on. So it works that way. So enough about that. The last thing I want to talk about is when I got involved in the multidisciplinary environment, I'll be the first to admit, I didn't know how to spell narrative report. Now, mind you, there were no computers back then. We talked to a dictaphone or we called it on the phone. And so I had to try to impress the medical doctors that I was with because they thought I was pretty good at what I did, but I never did narrative reports. So I got very uncomfortable, but I did recording and then, anyway, so I created the ability to do some very nice narrative reporting. But what I didn't realize is by using these narrative reports, that's the way how I was able to attract probably 40 to 50% of all my new patients. Once again, I didn't know that until it happened. I didn't sit around thinking this would be a good idea. So the last thing I wanted to share with you is how that worked. It was the most inexpensive but effective way to grow my practice. The other way was back school. That's for another time. But what I did was, in a private practice now, I was working both in San Francisco in a multidisciplinary environment, generating reports, and then I started to do the same thing in my own office because I was just impressed with the idea that I can communicate in a very effective way. And I started to do something very simple. I took patients and started through my history to find out all the doctors that had treated them for that particular condition. Then I started to expand that list into, could you tell me any physicians that you've been managed by across the board? So as you can imagine, there's probably maybe 3 or 4, depending upon whomever it might be.